I would hate to be unduly pessimistic. They would hate me to be unduly pessimistic. But funny flicks, as ever, as I say, I love the comments that you put, whether I agree with them or whether I don't. And I will generally, there seems to be no way to process these comments or to indicate that I've looked at them except by putting a little love heart next to them. It seems a very strange way to behave in a sort of adult way. But so I will turn, with very few exceptions, I will love heart all the comments. And with most, I will put a thumbs up because I salute, the effort that has gone into actually bothering to write a comment on my rubbish. So thank you. And if the least I do in terms of leaving a comment is to say thank you, that again is really a thanks for the comment. Is not necessarily in agreement with what you're saying. I don't always agree with what people say, but I like to hear what people are saying. Now, I loved this comment by Funny Flicks. Strike while negotiation is not possible, so that they can claim the government are refusing to negotiate. I think it's a very cynical understanding of the doctors' strike, but I think the facts support that observation. If Barclay and the person leading the strikes are both on holiday, and it's a little bit like the train strikes, what are we to conclude? It's not good. A strike should be the last recourse, the last weapon in the armory of a worker. And it's a valid weapon. But don't use it just to make a futile point, just to make the paying customers miserable, or in this case, people who have pending operations, people who are sick, people who are in need of help. The NHS is already on its knees. What we need are solutions to get it back on its feet. And I think those solutions involve paying doctors more. They involve paying nurses, paying cleaners more. They involve getting rid of a lot of the bureaucrats and making sure that one hospital talks to another hospital and that notes are circulated. In the last 15 years, I've been in hospital twice, and on both occasions, one hospital didn't talk to another hospital, and my life was in danger, in serious danger. In the second case, I had to go back into hospital for further care because the first hospital hadn't paid attention. And of course, they don't pay attention to me. Why would they? But I also knew what should have been done. But I'm just the patient. So if the doctors and the hospitals are not doing their bureaucracy correctly, they are putting the patients in danger, whether the patients know it or not. And I must say, I feel very anxious about the NHS, about the future of the NHS. I think the NHS is a remarkable concept where medical help is available from the cradle to the grave at the point that it's needed, whether you have the money or not. But we need to make sure that as a bureaucratic system, it works smoothly, and it isn't working smoothly at the moment. And I don't think that's about a lack of will. I think that's about a lack of system. I think the system is deeply flawed and has been allowed to get deeply flawed. And I don't think it's about favouring public or private. In the end, the publicly funded system has to rely on private services. It has to rely on, for example, the supply of electricity, the supply of paper and books. These are supplied by private companies. Not everything is done through the state. This is not a communist organ. And getting the best of what is private and using that in a public way for the public, in a way where the service is available at the point when it is needed. That is what the NHS is all about. That is the spirit of the NHS. And from the very beginning, it was making use of public funds and private funds. It had to. And this banging on about the purity of the NHS is a nonsense. We need to bang on about the aims of the NHS. Those aims don't change. Those aims are to provide a service for all.